There are several methods of contraception available, each with varying effectiveness rates and proper usage guidelines. Here is an overview of the most common methods. Hormonal methods. Hormonal methods of contraception include birth control pills, patches, injections, and vaginal rings. They work by releasing hormones that prevent ovulation, thicken cervical mucus, and thin the lining of the uterus to prevent implantation of a fertilized egg. These methods are highly effective when used correctly, with a failure rate of less than 1% for perfect use and 7% for typical use. Barrier methods. Barrier methods of contraception include condoms, diaphragms, and cervical caps. They work by physically blocking sperm from reaching the egg. These methods are less effective than hormonal methods, with a failure rate of 2% for perfect use and 15% for typical use. Intrauterine devices. IUDs are small, T-shaped devices that are inserted into the uterus by a healthcare provider. There are two types of IUDs, hormonal and non-hormonal. Hormonal IUDs release hormones that prevent ovulation and thicken cervical mucus, while non-hormonal IUDs contain copper that is toxic to sperm. IUDs are highly effective, with a failure rate of less than 1% for both types. Sterilization. Sterilization methods include tubal ligation for women and vasectomy for men. These methods are considered permanent and should only be used by those who are certain they do not want to have children in the future. Sterilization is highly effective, with a failure rate of less than 1%. Fertility awareness-based methods. Fertility awareness-based methods involve tracking your menstrual cycle and avoiding sex during your fertile window when you are most likely to conceive. These methods can be effective when used correctly, but are less reliable than other methods. The failure rate varies depending on the method used, but can range from 1 to 25% for typical use. If you did not use protection or a safe method, and pregnancy is likely, then it is best for the girl to take an emergency pill within 24 to 48 hours. But do not use it a lot. It has side effects on a woman's health. It's important to remember that no method of contraception is 100% effective, and the effectiveness rates can vary depending on individual usage and factors such as age and health status. To ensure the best possible protection against pregnancy, it's important to use the chosen method consistently and correctly. It's also recommended to talk to a healthcare provider to determine the best method for your individual needs and to discuss any potential risks or side effects.